The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Sweaty and pissed. Menopause makes me sweaty and pissed.
Well, hello, everybody.
Hello,
Hello, it's Karen Nickell, nurse practitioner.
Leanne
And we
Morgan,
have-
comedian,
Yes.
and recording from my bedroom with two beagles laying at my feet.
This is Sweaty and Pissed, Menopause and More. And I like your headboard there, Leanne.
You like my, I was telling Karen that I hate my headboard and it looks like, what did I say, Karen? It looks like that television show in the,
Laughing.
Laughing. I look like Ruth Buzzy when Goldie Hawn would have that tiny bikini on and some boots. Forrest doesn't know about that because he's a baby, but they do go dancing and it was all these wild sets. Do you remember that? How crazy it was? Well, that's how my headboard looks. And let me tell you, it does not. It was very inexpensive, and Chuck likes inexpensive and doesn't like to spend money. And I have had to live with this thing, and he goes, nothing's wrong with that. Or and he'll say, when I say during Mother's Day, you know what, I think I'd like a new headboard. He'll go, I'll cover it. And I'm like, you're not an upholsterer. And so at one time I went and looked at a fabric, and by the time you buy the fabric and put it on there and do the nail heads, it was going to be more than what if I went to Pottery Barn or somewhere and bought another headboard. So anyway, we have fought back and forth about this headboard, and I cannot find bedding that it is so funky and wild that I can't find bedding that matches it. You just have to go with white or a solid color. And then, and I don't know, I just, when you saw me in it, you go, oh, look at that. But I think you're excited because we've been filming from my dining room where there's just white paint behind me and I look like I'm in prison. So I need to do, during this stupid COVID, I need to get some botanicals, or I'm thinking botanicals, like three big botanical behind me, but because I have to do a lot of Zooms and during this stupid COVID, and I am so tired of it. And I don't know how you're doing telehealth, how you're not running down the road with your bra on the outside of your clothes. Are you tired of it?
Well, the program isn't fantastic. So, and it's so dependent on how good the signal is for the patient. So we often have a lot of freezing because people have, in varying levels of connectivity at their home. So that's a little bit of a problem.
Oh, I bet it is. Because I went with Lucille and Jimmy, my little mom and daddy, to my sister's house because my mom had a telehealth appointment with her a neurologist, not her neurosurgeon, but a neurologist. And God love him because he was trying to talk, and my mama, he wanted to know about her speech, and my mama started singing "Old Rugged Cross." And my niece was behind it. She had to set the whole thing up, and she was trying to keep from laughing. And then my little daddy came here and didn't have his hearing aids in. And I just thought that poor neurologist is like, who are these people? And Mama would try to tell him, like, my mom's loves a good joke. And it was like, you could tell he was in a hurry and he had to keep going. And I love a good joke. I really do. But I was like, okay, Lucille, listen, you just tell him what he needs to know. So anyway, we got through it. That I'm sure he got off of that and told everybody in his office, what in the world was that? Mom started singing, an emblem of suffering and shame. She likes to emphasize the shame. She thinks that's so funny. But anyway, I'm sure that you feel nutso. And I feel nutso, and I went walking yesterday through the Oak Ridge Arboretum at the University of Tennessee. Nice. Oh my gosh, It's beautiful. And you feel like you're in the Smoky Mountains. But because, we're so lucky to have the mountains near us, but I didn't have time to do that. And so I go to the Oak Ridge Arboretum, and it is stunning.
Oh, well, was it crowded?
Oh no, no. It's
Oh.
never it's you hardly ever see anybody. You see a bunch of wild turkeys and some
Mm.
wildlife, deer. I mean, it's beautiful, and it's and the paths are so wide that, it's not like you're going to throw COVID at somebody. You're going down one path, they're coming. It's like a hiking trail but wider. And
Oh,
it's beautiful. Now the main station is not open where the bathroom is, and that's a big bummer
problem.
because me and my bladder. But I just try to empty my bladder before I go, and then it's about 4 miles. It's in and out of these trails, and it's unbelievable. But anyway, I go, and that makes me feel better to get out and do. And then I come back to my house, and I don't know, it's just I need people. So and I can't tour,
Yeah,
and it's just a weird time. But
very strange time. Well, that's a nice tip on the Oak Ridge Arboretum. I need to check that out.
oh, you would love it. Well, let's go walk sometime.
Let's do it. I
I
haven't
think
seen
when
you
you
in
find
person in 100 years.
I know when you find, somewhere where you can see beautiful greenery and foliage. I mean, it's beautiful. It's their arboretum, so you get to see all this nifty holly and
Hmm.
evergreens, and it's cool because it's shaded.
Do they have a lot of native plants there?
Karen, I probably should pay more attention. Yeah, I'm sure it is. I'm sure that's what it is. But
Yeah.
I just really, it makes me feel better than going on a path that is concrete where I don't in the sunshine, and I don't want sun damage, and I'm
Right.
hot, and it's so muggy here in East Tennessee. So it really makes a difference. Um but anyway, feeling very inflamed, feeling fat, but I'm trying to do low carb, but I can't do real low carb and have a yeast die off like we talked about. I've got too much to do. I've been filming a digital series, um, and I have to film tonight, and it goes live on Facebook Live, and it's talent
Oh,
search and for sketch artists and sketch people and theater people, and so I can't be in a yeast die off and be in the bed. So I have to be perky. So I have to have a little bit of a carb so that I don't feel like, I've been knocked in the head.
how many episodes of that are they doing?
It will
Do you
end
know?
up 5.
Oh, good.
Yeah,
Is
we
that
have the
something? Is
finale.
that something? Is that something everybody can view, or is that a?
Yes, everybody can get on my page, Facebook Live, and it will be it's 8 o'clock Central tonight, 7 o'clock. I mean 8 o'clock Eastern, 7 o'clock Central, and we have 3 more contestants tonight, and they have one stand up in it, and but they're really looking for sketch people to do this platform that I'm doing this for. Um, it's called It's a Southern Thing, and they have people that do sketch funny videos that relate to the South and Southern things, Southern food, Southern colloquialisms, all kinds of things. And they have millions and millions of followers. And
Hmm.
so they asked me to be the host, and these 3 main cast members that they have are the judges. And people submitted their 2-minute video of something funny and entertaining sketch, and then they also had stand up send in clips, but really stand up and sketch are apples and oranges. And so, but anyway, we've got really somebody funny coming on tonight that kills me. And so
Oh,
I can't give it away, but yeah, it's had thousands of views, and people get on and watch it live while it's happening.
well, and since this is going to air in a couple days, is that something that they can?
Well,
Is it
it'll air
recorded so
tonight.
that?
We'll do it
Right.
tonight, and it'll be on tonight, and then it'll live there, so people can always watch it whenever they want to.
Yeah, right. So you can do it on demand. Well, that'll be good. Well, that's exciting.
Well, something to do, honey, during the COVID.
Well, no
So
kidding.
yeah, just something to, have fun with. And
Yeah.
My daughter is doing the makeup. She's a makeup artist and they've hired her to do it. And so
Oh, really?
that's been good. I mean, most of the time she doesn't want to slap my teeth out. Sometimes she does. She gets frustrated with me. But we did a video. Let me tell you this, Karen Nickell. So we did a video the Monday night we filmed for we did it, and Tess did my makeup, and I
Yeah.
looked so crusty and old, and I tell people I look like Darlene on Ozark. And I don't know if you've been watching that, but you got to watch that if you haven't.
No.
And Darlene looks pretty rough on the show. And so I said, Tess, let's just film real quick of you doing my under eye concealer and kind of brighten me up for this shoot.
Mm-hmm. Mm-hmm.
And she did it. She doesn't want to do that kind of stuff. And she just has never done a lot of videoing. She just is not comfortable yet. Anyway, I said, just do it and we'll film it. If you don't like it, we don't have to post it. Well, she said,
Right.
you know what? I like it. And let me tell you, Karen, she looked like a movie star on it. And she
I bet.
was so articulate and did such an unbelievable job. You got to go and watch it. She changed how I looked with this one quick tip. And I mean, it's close to 1 million views on Facebook.
What?
Yes. And people,
So,
thousands of comments saying, what kind of product did you use? What was the brush you used? Can you do tips for people over 50? Da, 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 da. So we're going to start doing them. And we're going to film tonight of her putting eyelashes on me because people want to learn how to do their own false eyelashes. And so I think that's what we're going to do tonight. But she was, I got to toot her horn, honey. She was, and people were going, oh my gosh, your daughter, she's beautiful and funny. And we really had a good time. And it's gotten a lot of, now it's over 1 million views with Instagram and Facebook.
wow. Well, so that's both on your Instagram and Facebook page?
Yes, on my Instagram and my Facebook. And
Yeah.
and I can't mention products because I do some advertising. So unless I'm being paid by somebody, I can't mention it. So,
Yeah.
but she can, people can, if they go to my page, then she has been tagged in it. They can go to her page and find out what she used on me. Because if Tess is a product, like she just sets and studies like what products really work, what doesn't. And she's about to rep an anti-aging line, Karen. And she's going to she's already started, but she goes to people's homes and they can hire her to go through everything they've got, throw out what they don't need, tell them what they do need. It kind of help them organize all their makeup.
Well, she could be a YouTube star or have, subscriptions. People subscribe to her, her web page or something so that she can do tips for them.
I think so too. And she is stuck in the COVID, couldn't go to LA to work. And so she's having to live with her crusty mama. So she is, there's 1 million tips that she does on me to make me look presentable. And I just think it would be, people want to know, at our age, and when you've gone through menopause, like all of a sudden you're like, I can't wear that blue eyeshadow anymore. Just like I can't wear those J. Crew shorts. It's that, like all of a sudden, in my 40s, it's like I thought, oh, I can't wear that high ponytail. Something doesn't feel right to me.
It's a makeup reality check.
Yeah, it really is.
Yeah.
Did you notice that? Like all of a sudden, at a certain age, you're like, I can't be doing all that. I don't want Madonna's eyebrows anymore. So I think a lot of people, and especially when you go through midlife and perimenopause and menopause, and your skin changes and you get drier and da 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 da. Anyway, that's a good time to reassess, and so she's got wonderful tips for that. So
That's
anyway,
fantastic.
that's just a little plug for the baby child.
Well, I'll go on your Facebook page and watch the video. I look forward to that.
Thank you, Karen.
And speaking of you thinking you look like Darlene, in Ozark, one of our family members listens to the podcast faithfully, and she'd never seen a picture of you, and so she the way you describe yourself all the time, she thought you were like this frumpy, so I just expect her to have
A
just look
moo
really
and rollers
look
in
look
my hair. Yeah, I get that a lot. I get that a
she
lot.
said she said, "I saw a picture of her," and she said, "Karen, she is gorgeous." I said, I know." I said, "Well, she looks like a movie star." I said, "I know."
Oh, thank you.
Yeah.
Tell her thank you. Well,
Oh,
I do feel like, and the next time I come in there, I'll get you to look at my chest. I have these sunspots now that just came up, and I
uh,
don't know, I start looking at myself in one of those magnified mirrors, and I think, oh my Lord, no. And see, I haven't had a chance to go to my med spa where I get dermaplanes and chemical peels every other month. I'll get a chemical peel, and then I'll wait 6 weeks, get a dermaplane, and I was feeling fresh. And then the
yeah.
COVID hit. Yeah. So I've got hair on my face. I've got a beard. I've got a mustache. I've got a Tess, though. Tess will dermaplane me, but it's not the medical scalpel. But anyway, so once the COVID's over, I can get back to my routine.
Wow, yeah. All that skin pile up, you gotta get that taken care
I
of.
know all that. I got to exfoliate. And she'll say to me, "You haven't exfoliated, have you?" So she gets mad at me. But anyway, she wouldn't treat anybody else like this. It's just because I'm her mommy.
I know, you're special.
Hmm. She wants to whip me.
You know what? We were gonna try to talk a little bit about osteoporosis today. Do you still wanna do that?
Yeah, I think that would be wonderful, my darling. I don't know much about it, and I, I'd like to know. I saw a post recently on Instagram of a lady I
Uh-huh.
follow, and she was with her doctor who was talking about it. So I do think that's an important thing we need to discuss.
Yes. So, well, first, let me just say what osteoporosis is. It's most people know, but it's where we lose bone density. We lose our bones start demineralizing, and we have two stages. One is called osteopenia, and that's the first stage of bone loss. And the more advanced stage is called osteoporosis. And it typically begins to happen in menopause or even sometimes in perimenopause because we lose our hormones, because our hormones protect our bones. You knew that, Leanne, didn't you?
Yeah. Oh, they do so much, don't they? It's a shame.
Yeah, so estrogen slows the breakdown of bone. That's the most important hormone in terms of maintaining our bone density, but also progesterone and testosterone help build bone. So when we lose those hormones, we don't have bone protection and bone building like we did when we have the hormones. So um, one of our listeners asked, what can we do to protect our bones, either over the counter things or prescriptions. And so I thought we could just review some of those things. Uh, First of all, there are lifestyle measures. Taking calcium and vitamin D help. And vitamin D, we've talked about this on other podcasts, Leanne, where you want to ideally get a measurement of your vitamin D level so that you can be instructed what the appropriate dose is for you.
Hmm.
But if somebody cannot get tested for some reason, most people can take 1 to 2,000 of IU's of vitamin D daily safely. So vitamin D is very important, and calcium is very important. And ideally, we want to get as much of our calcium from our diet as possible. We used to tell patients you need to take 1,200 to 1,500 milligrams of calcium a day in a supplement.
Hmm.
And we're not subscribing to that anymore because it's too much calcium. And when we have too much calcium, our body has so much that it can't put it into the bone. So it starts putting it in other places like your kidneys, forming kidney stones, in your breasts that form breast microcalcifications, in your
Hmm.
arteries, which causes plaquing and stiffening of the arteries. So we don't want too much calcium. So I tell my patients to sort of figure out, take a day or two and write down everything you eat and sort of calculate how much calcium you get in your diet routinely, and then supplement that so that you get a total of about 1,200 milligrams a day. So,
Okay. All right. So let me ask you, like the
mhm.
foods that you feel like do the best job.
Yeah, so dairy obviously is high in calcium. A lot of people can't eat dairy, but there are a lot of vegetables that are high in calcium. And you can always just go online and Google high calcium food list and get a comprehensive list of foods. But, like a cup of yogurt has 300 milligrams of calcium in it. So, if you ate a cup of yogurt every day, you're, a quarter of the way to your
Yeah, you're
to
well
your
on your
goal.
way. Mhm.
Yeah. Yeah, so it's not terribly, if you eat a healthy, well-rounded diet, it's not terribly difficult to get about 600 milligrams of calcium a day in your diet. So you would need to just take a 600 milligram calcium supplement a day. The other bugaboo about calcium is that it binds with a lot of things, so you have to take it separately from other medications, and that can be a little problematic because a lot of people take medications in the morning and at night, which means you pretty much have to take your calcium at noon, at lunchtime, which middle of the day can be a little tricky for people. But it is important. A lot of people don't realize that they shouldn't be taking calcium with their other medications. So that's an important piece
Okay.
of information. And one of the products I recommend to people is called Bone Up, BONEUP,
Mhm.
and it contains calcium, obviously, some vitamin D, and then several other nutrients that help with the uptake of calcium into our bone. So it's a good product in that regard. It has some additional things in it. Typically, a calcium supplement will also have magnesium in it because calcium tends to be constipating. Just what Leanne wants to hear.
Yeah, nobody needs that. I'm finally getting that worked out. Lord.
Yeah, so they put magnesium in it usually to balance that because magnesium usually helps us with
Yes.
regular bowel movement. So typically you'll see that. And then in terms of other lifestyle things, we need to look at diet, like we just talked about, just eating high calcium foods that in our diet on a regular basis, and also if you have celiac disease, that can be a pretty high risk factor for developing bone loss because of malabsorption of your nutrients. So we do have osteoporosis treatments that are not oral. So that those things, which I'll tell you about in a minute, would be good options if you have celiac disease. And of course, we always get back to exercise, don't we, Leanne?
Yes.
Um, so exercise is definitely a key piece to maintaining bone density. And what are you doing for exercise these days now?
I've been walking a lot and I try to do like a weight bearing, like Pilates or yoga video or now I did go to Jazzercise the other day and had a ball.
Oh,
And they are open where you can go in, you have to wear a mask, and then they have it taped off. Only so many people, you have to make a reservation, only so many people can go.
mm-hmm.
And once you get to your spot, you can take your mask off. And
Mm.
Jazzercise is so fun, and it puts me in a wonderful mood, and they are so cute, the people who teach, and we have a ball. And then at the end, you do small weights and mat work.
Oh, good. Perfect. So you felt safe there.
Yes. It's in a big
Good.
old gym in a Presbyterian church.
Great. Well,
Yeah,
that's
people are 6 feet apart or more than 6 feet apart.
sounds like they're doing it right.
Yeah, and they posted something the other day, if everybody do what they're supposed to, we can have Jazzercise in July. So everybody just, do what you're supposed to do. So
Yeah.
I don't know if
Yeah.
the heifers that are not doing that, if they're gonna, kick them out. I don't know what's gonna happen. But I do like I'm a real follower. I do what I'm supposed to do.
Good. That makes a difference. Well, and it's interesting too, in terms of, some people think, oh, I have to do high intensity exercise like running to maintain my bone density. And studies have shown that even walking helps as much as something high intensity like running. So lower intensity exercise does help bone density. So you don't have to become a marathon runner,
Yeah,
which
and
is,
Karen, really, I mean, I've thought about, oh, I'd like to train for something and that be on my bucket list. And then I have people
Mhm.
say, you don't want to break down your breast tissue and your jowls. You're beating the pavement, your knees, at your age. So, I've had doctors say that to me. So
Yeah.
I think walking pretty much does everything except beat you
Yes,
down, right?
yes, and walking is weight bearing. I mean, you're bearing your own weight. So one thing you can do if you have, particularly if you have real low body weight for, real petite or thin woman, or man, you can actually get things like weight vests, where it's a vest you wear and you can slip in weights, as many or as few as you want, and help put some um, weight on your upper body for your spine. Because it's, we obviously our hips are going to bear more weight than our spine does, just because there's less above the spine than above the hips. So, anyway, a thing like weight vests can help too. If you a little hot to wear outside in the summer, but if you're a mall walker, it could be a good option. So, or in the winter,
Mhm.
um, yeah. So, but walking is great. The other lifestyle things that can help with bone density is to stop smoking. If you're smoking, if you can't stop for a bunch of other reasons that we need to stop, then smoking really accelerates bone loss.
Mm,
So yeah, if you needed an additional incentive to stop smoking, protecting your bones is one of them. So
yeah.
yeah.
Mm.
So it's true. So, and the way we measure bone density is with a test called a DEXA scan, DEXA, DEXA scan, and it's a real simple test. Takes about 3 or 4 minutes. It's very short, and we look at your spine and typically both hips. There are some uh, people who are bone density tests that measure just one hip and the spine, but our office we measure two hips and both hips and the spine. We can't measure your hip if you've got hip replacement. And if you have both hips replaced, we usually do the spine and the forearm. So, yeah, so it's an easy test. It's low radiation level. It's about a 300th of the radiation we get from a chest x ray. So it's a low radiation level test. And we do it, if you have bone loss, we do it every 2 years. And if your levels are normal, we do it every 3 to 5 years. So, and we can do it in a year if you see some major changes. So, if you do a bone density test and you're like, oh my gosh, you're down 20% from your last bone density test, we can start treatment and recheck in a year. Yeah. So, and it's important, once you become menopausal, especially to get a bone density test done. They're easy and inexpensive, so there's really no reason not to do it. So we have some medications that we can use to help with our bone density. You haven't taken a medication for bone density, Leanne, but I mean, the hormones you're taking are one of the treatment options.
Oh.
So, yeah, especially for osteopenia. We don't have a lot of medication choices for osteopenia. We have more choices when you become osteoporotic and have osteoporosis. We have more options, but we have, for osteopenia, we have, of course, hormones, and we have something called a bisphosphonate. And you've probably heard of bisphosphonates like Actonel, Fosamax, Boniva, or the
Bonita, I've
branded
heard of
names.
that when Sally Fields
Yeah.
would do that commercial.
Oh, right. That's right.
Remember
Good old
that?
Sally.
I remember little
Yes, I do.
Sally. Mhm.
Little Sally. So, some of them are once weekly. Boniva is once monthly dosing. It is a medication that when you take it, you have to be able to sit upright for at least 30 minutes after taking it, and you have to take it with a full glass of water because you want to get it down into the stomach as quickly as possible because it can damage the esophagus.
Oh.
So, yeah. So, if you can't sit up, that's not a medication for you. If you have esophageal problems like a stricture or esophageal varices, any kind of esophageal disease, not the medication for you. The other thing about the bisphosphonates is that at 5 years of treatment with bisphosphonates, we are seeing more femur fractures, so fractures of the thigh bone.
Oh.
Yeah. So we typically take people, once they've been on it for 5 years, we take them off bisphosphonates and look for something else to treat with. So, and we do have one IV bisphosphonate. So if you did have esophageal problems, couldn't take it orally, um, we do have a once yearly IV bisphosphonates. So, and then we have Avista. Do you know anything about Avista?
I've heard of that.
Yeah, Avista is in the family of tamoxifen, and we use tamoxifen for people after they've had breast cancer
Mhm.
to help reduce risk of recurrence. So, Avista or generic raloxifene is in that family. So it can be a good option for somebody who is at high risk for breast cancer or who has had breast cancer and is no longer on a medication for breast cancer like tamoxifen or anastrozole or letrozole. So that can be a good option for them. The downside to Evista is you can't be on hormone therapy while you're on it, and you have a higher risk for blood clots with Evista. So there's always, when trying to decide what to use and treat with, there's just a lot of things you have to balance in terms of risk versus benefit.
It sounds
So,
like it.
yeah.
Can I ask a question?
Yes.
Okay, so when you say that it's in my hormones, is it is it in my estrogen cream that I use? Is it in
Yeah.
that or is it my
Yeah.
testosterone?
So, well, all your hormones, like as I was saying, your estrogen slows breakdown of bone. So by using estrogen, you're helping protect your bones, and by using progesterone and testosterone, which build bone, you're helping protect your bones. So we're just replacing what you're no longer making because you're in menopause.
Okay.
And
All right, let me ask
and
you this.
yeah,
When you talked about bone up,
yeah,
if I eat, try to get as many vegetables and dairy and all that, and do you think somebody like me that I need bone up?
if you're not able to get 1,200 milligrams of calcium in your diet per day, you probably need some supplementation of calcium to get to that point.
Okay.
Does that make sense? So if
Yeah.
you calculate that, okay, I get 800 milligrams of calcium a day in my diet, then you would just need to get another 400 milligrams with supplements.
Okay, and you can get bone up anywhere?
Yeah. Oh, yeah. And I think I'm trying to remember the dosing. I think 6 caps. It's a lot of capsules. 6 capsules has, I believe, it's 1,000 milligrams of calcium in it. And so, if you only needed 300 milligrams, you're looking at taking 2 caps a day of
Yeah.
that.
Yeah, it just excited me when you told me about the magnesium. I'm a big fan of the magnesium,
Yeah. Yeah.
and, I take the magnesium at night, and I'm trying to think I can't get to it right now, but I'm trying to think I know there's different kinds of magnesium, right? I mean, or there's not or
Yeah. Oh,
they
yeah.
put different so there's the one that helps you with sleep, and then there's a different kind that might help with pooping, and then there's right?
Yeah. Well, they're attached basically to different molecules. So we have magnesium glycinate, we have magnesium oxide. So magnesium glycinate is a form that tends to be better absorbed for people, so it can be more beneficial.
Mm-hmm.
So you want to use a highly absorbable form. And most of the time, when you pick up a magnesium in, a like a national chain pharmacy, it's going to be magnesium oxide. A magnesium glycinate is something you typically have to get at a health food store.
Okay.
Yeah.
Okay.
So yeah. So and the only other thing I would say about mention about the bisphosphonates is that if you have chronic kidney disease, that you're also not a great candidate for using bisphosphonates. So um, then once people have osteoporosis, we have some more choices. We have parathyroid hormone analogs, and those are injectables. We have one that's a daily injectable for 2 years, one that's a daily injectable for 18 months, and now we have the newest one that's a monthly injectable for 12 months. And these medications are finite because they not only improve bone density, but they increase bone mass. And those are two different things. The bone density is like remineralizing the bone. And when we increase bone mass, we're like filling in the bone, if that makes sense. So what we do is take these for a certain amount of time and then go off of them and then do what we need to do to maintain the bone we've built. And they are very, very effective at building bone. So,
Oh,
and then the other thing we have for osteoporosis is called Prolia, and it is a once every 6 months injection. And it's a biologic medication that works in a different way than the parathyroid hormone medication. So the only thing we have that builds bone mass are those parathyroid analog medications. And those are Forteo, Timlos, and Evinity are the three that we have. So, and they're good medicines. They're good medicines. So, uh, again, sometimes a lot of it is deciding where your bone density is and what your insurance will cover and what side effects it has. And there are just several factors in deciding the appropriate medication. um, I forgot to mention too on the exercise piece, there is a company called OsteoStrong, and we have one here in Knoxville. And it is, have you heard of that,
no,
Leanne, at all?
no.
It is a franchise, and they have specific exercise equipment that are designed to build bone. So they're resistance equipment for bone building, and it's this a circuit that you do. It takes about 10 minutes to do the whole circuit, and you do it once a week. And it includes a machine that has fine vibrations.
Oh, wow.
Yeah, so we should all hung on to those. Remember those machines that had that big band that went around your
Yeah.
rear end and it shook you?
Yeah.
Probably would help our bone density if we had those in our home again. But anyway, so in it, it's a bit pricey. There's a monthly fee to do that program. And I think it runs around $100 a month. It might vary in your area, and your area may or may not have one. We happen to have one in Knoxville, but it can be a non-pharmacologic option for people, because I do have patients who say, can I do some things with lifestyle and supplements first and try to avoid a med. So
Yeah.
that can be an option in addition to whatever other exercise you do. So
Oh.
yeah.
Well, I had no idea. Where is it in Knoxville?
It is out. It's near our office out in Farragut.
Oh, wow.
Yeah, yeah.
I had no idea.
So yeah, and I've had quite a few patients utilize that option and have done well with it. So again, sometimes it's a cost issue. Some people, it's just not in the budget. So
Yeah.
yeah, yep. That's all I got, sister.
Well, that was a lot, honey. That's a lot of information, but good information. And I've had the test, and I looked pretty good, didn't I, for my
Yeah, yeah,
osteoporosis?
yeah,
That was a while
yes,
back.
yeah. I need to check and see when you're due for another one.
Yeah,
But if it's good, like I said, if it's good, we usually do it every 3 to 5 years. So
yeah. I bet you I'm coming up on that.
probably, yeah.
Yeah, but it was good to know. I mean, I don't think I don't think my little mama or my sister has had any kind of issues. Would it be like a genetic? I mean, do you have that component too?
Yes, there is that. If there's family history, also if you're a thin white woman, you're at much more risk for bone loss. So uh, I try to have everybody checked as early in menopause as possible, so we can head things off at the pass rather than trying to fix them
When
later. You know.
Yeah. Well, I'm sure you've had yours checked, you little thin, frail thing. You're a thin, frail white woman.
Yes, and I have some bone loss because of it. So.
You do?
Hmm.
And when I say frail, you're not frail, you're strong. You're a strong, thin woman. But oh,
Try to be anyway.
see that this big butt has its purpose.
Well, it's true. I mean, the more you weigh, the more weight bearing you have. So
I'm bearing a lot of weight. Yeah. My big booty at the Arboretum. My big booty that's done a lot for me. I got a man with health insurance. I shouldn't say that in this day and age. That I wouldn't say that in front of my girls. I'm not going to say that in front of them. This is just in front of girls my age. Mm. Um. Well, okay, my darling. Is there anything else we need to
I
tell
don't think
people?
so. I don't think so. Just
Okay.
remind everybody about your Facebook uh, show.
Oh yeah, I'm never good at time. So you're right. This podcast will be Saturday, and I
Right?
will have yes, and that I'm alone. So that will be I will have already filmed it, but yes, it will. You make so much more sense than I do. So that will be living on my Facebook page, and so people can watch it if they want to. And then the finale will be July the 16th, and I'm supposed to be in Florida, and I don't know if Florida blows up. I don't know.
Gosh.
And Chuck said,
Where
"Are we gonna?" Well, it's on the Gulf, and the everybody I've talked to said, we just don't have a problem here. It's places like Miami, Tampa, and Orlando. But we I guess we would drive straight to a rental house, and because we've rented a house already, and we rented it a long time ago, and sit in that house and look at each other and take our groceries to Knoxville. But if we have to do that, at least we're together. I'll get to be with all my kids, and this will be the vacation before our little baby comes for my baby. I call this my baby. I'm having a baby, and and but next year, Maggie keeps saying, "Oh my gosh, Mom! Next year we'll have a little baby in a sun hat and a little swim diaper." And so this will be, and then we'll be on fire then. So this will be the year before. I mean, the summer before our little baby comes.
Oh, that's so
I
exciting.
know. I'm thrilled. I am so thrilled, little boy. And I
Oh.
know. And and Maggie goes, Mom, we can't do this to Mary, my daughter-in-law. I tell everybody I'm having a baby, and she's like, we got to quit saying that we're having the baby. Let her have the baby, and then we'll take it. And I'm like, yes. So I am looking forward. I'm already, I'm trying to figure out what room I'm going to put my nursery in. And
Oh.
yeah. And Chuck is the big baby whisperer at Children's Hospital. I
Yes,
have told
yes.
he cuddles drug dependent babies, so he's got a gift with them, and so I've told my children, I go, y'all really don't have to worry about anything because I will be washing clothes and cooking pinto beans, and your daddy will be walking the hall with y'all's little babies, and they'll be so calm, and y'all can go to Target, or you can go to you can go on a date and go out to eat and then make out in a parking lot. I just didn't have any help. I had Chuck's
Yeah.
people were around me up in Morristown, Tennessee when my babies were little, but his mom and daddy still worked and they were busy. And I mean, I'll be working, I'll be traveling hopefully when the COVID's over, but I'll be here during the week. I can help tend to this baby.
There you go.
You know,
That'll be so much fun.
so much fun. I'm so
I know.
excited. I know.
I'm
So,
excited for you.
thank you, my darling. Thank you.
Yeah.
Yeah. So I want to keep my bone health right because I got to
Yes.
pack a baby places.
Yeah. Well, lifting a baby, carrying around a baby will help.
Yeah. I just don't need to. I remember, and I bet you did this too with Forrest. I would hold my babies on one hip on the right side, and then I got sciatica. You get sciatica during pregnancy a lot, and then you hold that baby on one hip, on one side, and you get all out of whack. Plus, you're up all night and you're breastfeeding. It's a lot. But anyway, my little daughter-in-law will have the help, and so I'm glad that we all live near. But that'll be a blessing. So
Yes.
okay, well, all right. I know
Yeah.
you're probably going to do a weight bearing exercise somewhere, girl.
Probably going to be doing. Actually, I'm going to do that at home. But and I hope you have a very happy 4th of July.
Oh, y'all
And
too.
yeah. So hope everybody will be able to celebrate in a safe way.
Yes, I'll be with my little elderly parents in a very safe environment. Probably cooking and tending to them, but I hope that y'all are you going to your pool? What are you doing?
We don't really have any plans. Probably just hanging out here, staying home.
Okay.
So,
Well,
but
that'll be fun. You've got a beautiful view. You can, honey, make some baked beans and have a ball. Watch the fireworks. Or I don't know. Will there be any fireworks?
I I didn't see any announced, so I'm not aware of any. But that doesn't mean it's not happening.
Yeah.
So,
I didn't even think of that, but because Knoxville has such beautiful, and you've got a beautiful place to watch them. But all right, well, it'll all be all right. This'll all pass, won't it, Karen? Say it's going to pass.
it will pass. It will pass. So
Okay.
we'll all be together again sometime. So
When is your good guess? We'll get off of here.
yeah, it'll be a year. Sorry.
A year from
Uh,
now?
Probably, yeah. That's just my educated guess. But
Oh Lord.
but don't despair, don't despair. We'll learn how to live this way and do well and look forward to the future. Yeah.
Yeah, because after the Spanish flu, they were drinking gin out of a bathtub. Remember that? And everybody had
Yeah.
syphilis. Al Capone had. So surely, okay, I know I get off on a. Okay, it'll all be all right. God is on the throne. Okay, my darling. Well, you have a wonderful day.
You have a good 4th. It's great to see you and we'll see our listeners or we'll be with our listeners soon.
Okay, I look forward to
Okay.
it.
Stay well, be safe.
All right. Bye bye, y'all.
Bye.